also NGOs. I monitor projects and evaluate projects, focusing mostly on FGM, but also child marriage and other forms of violence against women. And I want to thank Janet for giving me the opportunity to speak here today and to share with you some of the results of my quick research that I did in the past week.
You're very welcome, Annemarie. Could I ask everyone to please put themselves on mute if they're not a presenter? Rhobi, do you want to just introduce yourself very briefly?
Surface of the eye of the
yes, thank you very much, Janet, for this opportunity.
Rhobi, sorry, we can't hear you. Rhobi, can you start again?
Hi, everyone. Can you hear me now?
Yes, we can hear you now. Thank you.
Okay, my name is Rhobi. I'm in Tanzania, in Marwa region. I'm an FGM survivor. Today I will do a presentation on FGM in this time of Corona-19. So you are warmly welcome, and please let us share and see how could we do in order to improve girls' health and safety in this time. Thank you.
Thank you very much, Rhobi. Michael?
Thank you.
Hi everyone, good morning, good afternoon, good evening from wherever you are. My name is Michael Marwa. I'm also in Tanzania, like Rhobi, and I work with an organization called CSEMA. CSEMA runs the National Child Helpline here in Tanzania, and I happen to be the director of the National Child Helpline, but also I am the regional deputy representative of child helplines in Africa, overseeing over 43 child helplines across Africa. You're warmly welcome. I'm glad to be part of this webinar. Thank you very much.
Thank you very much. Anna?
Hi everyone, greetings from near the Arctic Circle in Finland. I'm Anna Holmström and I'm the regional manager for Felm, which is a Finnish NGO. And for the past 11 years, I've been working with Michael, Rhobi, and many others on ending FGM in Tanzania, predominantly as the head of the FGM program at UNFPA Tanzania, but now also working on these issues with Felm.
Thank you, Anna. So what we're going to do is, firstly, Annemarie is going to do a presentation giving the overview of the current situation around COVID and FGM. Then Rhobi will talk about her experiences on the ground in Marwa. Then we'll hear from Michael, and then finally from Anna. And then we hope there will be a lot of chance for people to ask questions. Please do type your questions in the chat as we go along. And please do keep yourself on mute so that we don't get lots of feedback. Thank you very much, and over to you, Annemarie.
Thank you so much, Janet. Let me try to share my screen. Can you all see my screen?
I can see your screen. Can you just wait one moment, Janet? Have you got the recording on, or do you want the recording started?
Janet, you're on mute.
Yes, I have, Ralph, but you do it as well, please.
Okay, switching on now.
All right.
Okay, right. Please let everybody know that we are recording and that they're happy with that.
Janet, do you want to?
Yes, we are recording this. So if you don't want to be featured, please switch your video off and don't use your real name. Please do start, Annemarie.
Okay. Thank you very much. So in the next 15 minutes, I'm going to present to you, actually I'm going to answer 4 different questions. And those are the 4 questions I would like to ask.
Oh, nice. Thank you very much.
Can you please mute yourself?
So the 4 questions I'm going to address are: what is the current evidence? And then I focus specifically on FGM and the COVID-19. What do experts say? What can we learn from Ebola? And will COVID-19 help or hinder our efforts to end FGM? So let's start with the current evidence. Of course, as we all know, COVID-19 is a very new virus. So the data and research on the impact of COVID-19 on FGM is currently very limited. I think this is not a surprise. There are no academic articles published yet. As far as I know, there are no reports from UN agencies, NGOs, or other organizations yet. In case you do know about academic articles or reports or other things that are published specifically on FGM and COVID-19, please share in the chat or send an email. That would be really helpful to know. As far as I know, in the quick search I did this week, I couldn't find any data. Now, it is too early, therefore, to have evidence-based information. However, we have emerging evidence on violence against women more in general, and also domestic violence and COVID-19. So what you see here is a working paper. I put also the link on all of my slides, so that allow you also to, click on the links because we shared those PowerPoint presentations, and to also read all those documents yourself. So that's a paper on pandemics and violence against women and children, but in those type of working papers, FGM is very often not specifically mentioned. However, 3 days ago, UNICEF released a technical note on COVID-19 and harmful practices that I will address shortly. In this technical note, was written: we know from the Ebola outbreaks and from other public health crises that adolescent girls are disproportionately affected by these emergencies. And I think this corresponds also with the feeling that we currently have. Now, since there is a lack of evidence and evidence-based information, I looked on the internet to find what experts say. So that's the only alternative that we have. Dr. Natalia Kanem warned us, and she wrote, as with most crises, this pandemic has severely disrupted access to life-saving sexual and reproductive health services and hampered authorities' ability to respond to gender-based violence at a time when women and girls need these services most. The World Economic Forum warned us as well. They say a potential rise in FGM, as well as early child and forced marriage, at this time of restricted movement, poor visibility, and weakened protection systems. Equality Now also released a statement on their website, and they're also expecting an increase in child marriage to protect young girls from worsening economic and security situations, and in some places a consequential higher incidence in FGM. Eva Komba, our friend, wrote a blog post on the End FGM European Network website, and she also shared with us that the ongoing pandemic has created the perfect conditions for proponents of FGM and early marriage to carry out their perverted motives. The closure of schools, opposed by the rule of law for institutions and organs, alongside an overwhelmed health system, including requirements for social distancing, has created a conducive condition resulting in the resumption of FGM and early marriage activities. Now, if I summarize that, COVID-19 will most probably lead to an increase in FGM, an increase in child marriage, and also an increase in all forms of violence against women. UN Women released a few days ago also this document that you see on the slide. And it focuses on ending violence against women and girls and COVID-19. The majority of the information is on domestic violence. And some results already show very worrying trends. For example, in France, 30% increase in domestic violence. And also in Argentina, 25% increase in emergency calls for domestic violence. So there is more and more evidence that violence against women in terms of social isolation or isolation at home increases violence against women. But again, in all those papers, there's another paper of WHO that you will see here. Most information is focusing on domestic violence, not as much FGM or child marriage. However, this technical note of UNICEF is specifically focusing on harmful practices. So it's a technical note on COVID-19 and harmful practices. That is the title. And what I found interesting when I looked up this paper is that it makes a comparison with the Ebola crisis. And that made me think, because we don't know yet the magnitude of the COVID-19 crisis. However, we can look at the Ebola crisis in West Africa and see whether I wanted to know what the impact of FGM was at that time and what we can learn from that. So the next question I want to address is, can we learn from the Ebola crisis? Now, when I studied the Ebola crisis and its relationship with FGM, I actually saw three different phases in those 2 years of the Ebola crisis. So before the Ebola crisis, there was a little decline of FGM prevalence in West Africa. I included here two graphs. One is focusing on Sierra Leone, the one on top, and the other one is focusing on Guinea. And you see that there is in those countries a slight decline in the prevalence. The very first months of the Ebola crisis, FGM continued to be practiced as normal. I think also in many European countries, in the very early weeks, we didn't actually know what COVID-19 was. It was very much underestimated, and things in the very early stages continued as normal. However, the second phase I noticed in the Ebola crisis, there was an interruption of FGM. And this is what I think is very interesting. So FGM was interrupted in Guinea, in Liberia, and in Sierra Leone. And I asked myself the question, why was that the case? And I found that leaders, including Muslim leaders, called for an end to prevent the spread of the Ebola virus. Also in Sierra Leone, as we all know, there is no law against FGM in Sierra Leone, but there was a nationwide ban on FGM during the Ebola crisis. Also, the Ministry of Health conducted outreach campaigns to educate traditional leaders, but also the Suwais, the traditional cutters, on the dangers of performing FGM during the Ebola crisis. Also fines were provided. So 500,000 leones, that's about $60 US, which is a huge amount of money for performing FGM. It was not only the government, but also paramount chiefs and councils of Suwais who enacted bylaws, so customary laws or memorandum of understanding to postpone FGM in order to reduce the risk of Ebola to spread. So at a certain moment, activists were very hopeful because FGM appeared to be on a drastic decline in Sierra Leone and other countries as a result of the Ebola crisis. So here you also see a newspaper article, Ebola fears bring female genital mutilation to near halt in Sierra Leone. But then phase 3, after the Ebola crisis, unfortunately, this trend didn't continue. It was only temporarily. So FGM resumed after the end of the epidemic, and it resumed up to the prevalence as it was before. So there is one study published in 2019 that also concludes when the Ebola epidemic was over in 2015, there was a return to business as usual by the country SOAS, and FGC has returned. Now, then is the question, why is that the case? I found that a female paramount chief, for example, sat to and recommended people to go back to the bush to uphold our culture and tradition. So there was a push from the very same people who actually halted FGM to continue with the practice again after the Ebola went away and there was no risk of spreading the virus. Now, what can we learn from the Ebola crisis? Well, there are some very interesting findings. Unfortunately, the disruption could have led to a positive social change, but this didn't happen in West Africa. Another thing I found really, really interesting is that during the Ebola crisis, as I said, FGM decreased, but child marriage and teenage pregnancy was increasing. So if we look back at the expectations of experts, everybody expects an increase in child marriage, an increase in FGM, an increase in all forms of violence against women. But during the Ebola crisis, you see that child marriage and teenage pregnancy increased. So parents were indeed marrying off their daughters. There was an increase, probably because of economic motives and interests. However, FGM decreased. So apparently those girls were married off without being cut. And this is quite interesting because it shows that the drivers of FGM and child marriage might be different in terms of crisis, in times of crisis. Then the last question I would like to ask is, will COVID-19 help or hinder our efforts to end FGM? And in the past few days, I've been thinking about potential risks in relation to FGM specifically. And I divided my first thoughts into potential risks for girls at risk and also potential risks for girls who have already undergone FGM. Now, for the girls at risk, I see various problems. In the first place, that practicing communities take advantage of COVID-19 since all schools are closed. And we all know that girls are often cut during the school holidays. And social distancing makes it easier for parents to force their girls to undergo the practice. There is less support, less protection, and also since the schools are closed, there's no teacher, there are no friends that look over the girls, so they're more vulnerable in that way. Because of the COVID-19, there is no or limited law enforcement in some countries where FGM is prevalent. So some courts and other law enforcement institutions are already closed or may be closed in the future. The government has clearly other priorities, and this means that the law perhaps no longer has deterrent effect, or practicing communities know that punishment is very unlikely. A third potential risk that I identified is that NGOs and campaigners are disrupted from their important work. So due to the lockdown, many activities, and we know that NGOs do vital work, it's so important what NGOs do, but those activities cannot be organized due to the lockdown or the social distancing rules in various countries. And Rhobi will tell you and share with you her experiences in that regard in Tanzania. Now, potential risks for girls who have been cut. So since we or some experts expect an increase in the prevalence of FGM, there is a risk related to the immediate care that those girls actually need. So we have an overwhelmed and under-resourced health system, which means that there is no or only limited access to health information and services, and there is a risk of more harm. The UNICEF technical note also expresses concern in relation to the fear of infection, violence, and mistreatment by health workers for girls who underwent FGM, which can prevent girls to seek health services in case they are cut. And also another risk that also counts for girls at risk, NGOs and other professionals who previously helped victims of FGM are unable to operate because of COVID-19. But I'm sure that there are many more risks, and I hope that after our presentations we can have a discussion to, because I would love to hear from you as well, what you identify as potential risks in relation to COVID-19. Now, my conclusion, we need to act on the threats of COVID-19. I think we all agree on that. The risks that girls currently face are very high, especially when communities might see this crisis as an opportunity to get their girls cut. Many people that I spoke to in the past few days are very worried, and they say that the progress that we have achieved over the past years and the past decades is under threat. Many people are very worried about what is going to happen in the upcoming weeks or months. And therefore, I also believe that addressing FGM must be at the center of all plans on COVID-19 response. So we see that there is a huge emphasis on domestic violence, and I understand why. However, we shouldn't forget the consequences for girls who will be married off or who will be at risk of FGM. At the same time, I'm a very positive person, and I also think that we need to look at opportunities. So I was very surprised with the response and what happened during the Ebola crisis. So I think it's also important to investigate whether the COVID-19 outbreak might perhaps give us also a window of opportunity. So during the Ebola crisis, FGM disrupted. Well, maybe this will also happen during COVID-19. We don't know exactly what's going to happen, and we need to learn from what is currently going on the ground. I would like to conclude with the fact that I found that research on FGM specifically and COVID-19 is very scarce. But I think it's great that you are all here. It's a very important topic, and I would like to propose to work together and to share information, experience, and knowledge in this regard. So I think it's really good to come together to discuss this very important topic, to share information, to share your experience. I would love to hear, because I saw on the list of participants that we have people from so many different countries. So please, share with us, not only today during this call, but I think we need to continue sharing information and experience and knowledge in the future in order to be able to fight this horrible virus. So that was it for now, and I look forward to your questions. Back to you, Janet.
Thank you so much, Annemarie. That was fantastic. So we're going to move straight on to Rhobi's presentation, because then we're going to have questions for everybody at the end. However, in the meantime, if you do have any questions for Annemarie now, please do type them into the chat box, and I'm sure she could start answering them if possible. So Rhobi, I'm hoping that you can unmute yourself now, and I'm going to share my screen so that of your presentation.
Okay.
Right, Rhobi, do you want to start introducing yourself?
Yes. My name is Rhobi Samwelly. I'm the director of Hope for Girls and Women in Tanzania, based in Marwa region. Yeah. So as Hope, we are fighting against the female genital mutilation, especially in this during COVID-19. We are continuing with our activities in our organization, although some activities have stopped in this fight. We have 2 safe houses where we are protecting the girls who are escape FGM, but we also protect the girls who have already been cut in order to stay and give their testimonies to the courts.
Thank you.
I can.
Can everybody see the slides?
Yes.
Yeah.
Right.
Yeah.
Right. Sorry, Rhobi, please continue.
Thank you, Janet. Also, we have stopped doing the community outreach because of this problem of COVID-19. So we are not also doing any school interventions or film screening in the villages. So we only run these safe houses, and we have these girls and the survivors who are protected to the safe houses. But also we are also still in contact with the cutters around our communities who are helping us to rescue some of the girls in their villages. Also, we help in prosecutions for FGM, rape, and the GBV cases. What I can say due to the safe houses, since the school closure, we have started receiving girls who were free from FGM, especially in Serengeti district. Some of the parents are using this school holiday to start the cutting of their daughters, and they are doing it in secrecy and in the bushes. So I can say since April to now, we have managed to rescue 35 girls who are not cut, and 6 girls were already cut. But already we have received a list of the girls who have been already cut in 3 villages, where we have 147 girls who have already cut. So I can say through the safe houses, we are trying to make sure that the girls who are staying to our safe houses stay safe in this time of COVID-19. And yeah, but also to make sure that all the parents who were been arrested with the police are taken to the court in order the law to take the action upon them. So I can say in this time of the school closed, we are working in collaboration with the police, although we have challenges. The way we are working with the police, sometimes they are missing diesel. They don't have these protection tools like masks. Through our girls who are staying to the safe houses from the vocational class, we have started making different masks, as you see one of the police gender desk wear it. So we are trying to make sure that we are not missing rescuing of the girls in the community. So I can say the number of the girls due to longer season mean more girls now are cut, and some parents are using this time to cut their daughters. And there is a lot of violence in the community. We have already receiving some cases for early child marriage girls who are planned to be married, and we are collaborating with the gender desk in order to rescue them. Even today, we have rescued 2 girls in this early child marriage. And the parents have already received the cows and they want to marry her off. So this is the challenge due to this time of the COVID-19. Increasing of the girls to our safe houses is creating a challenge because we, for now I can say in one of our centers we have 107 girls. So the girls are sleeping 2-2. That is the challenge. Although we have a room where the new girls are coming and we isolate them for 14 days to see how are they doing, and then after we join them to other group. So we are trying to rescue the girls, but I can say this is the challenge. I'm not sure what will be happen if this COVID-19 will continue in our area. Yeah, maybe because the schools will continue to be closed, and the cutting will continue, and the other violences. I can say in this April, I have experienced 5 cases for the rape cases in our district in Serengeti. So we have stopped doing the community outreach. We are just rescuing the girls. We are not going to visit schools, because through schools is where we have these anti-FGM clubs and the trained teachers who were helping us to identify the girls who were at risk. Even the girls, it was easy for them to report to their teachers about the plan for their parents if they want to be cut. So this time it's a challenge. How are we going? I know we are going to continue receiving more girls, yeah? And how are we going to continue to support these girls? Because we know maybe even the support will be reduced from this program. How are we going to continue to rescue maybe the girls? Maybe the police will stop going in the villages. Those are the questions I'm asking myself. And the violence will continue in the community. No film screenings at all. We have stopped doing this. Yeah. We have stopped doing mapping. Through mapping, we do it, and we map the safe areas for the girls to be protected, and so that we continue to rescue them from their areas. It is easily, but for now, I can say there is no much efforts from different partners who may be going to the community, reminding the parents that this FGM is illegal, we need to stop it. So everyone, some parents and some people who want to continue with this violence, they are continue to plan, and they do. And bad enough, we have a lot of rainfall. Some of the rivers are full. I can say, like the day before yesterday, we went with the police to rescue some of the girls in a certain village called Kitarungu until you pass through the river, and the river was full. The vehicle cannot pass there. So what we did, we swim from that in order to go to another part. So really, it's hard time. Yeah. We have these digital champions in 87 villages in Serengeti. The digital champions, these women, are the one now helping us to give us information about what is going on in their villages. So they are reporting these gender-based violence cases. Is where we are getting information. There is a rape, there is something like this, there's a plan for cutting the girls, etc. So through those links, that is why even we can access some of the information from the villages, and we are ready to work and continue to rescue the girls, help girls and women from their villages from violence. But yeah, for this hard time, I don't know, because I'm not sure. How are we going to continue if this COVID-19 will continue? Yeah. Through our cutters, we have cutters who have dropped their tools down, and instead now they are supporting us in the fighting against the FGM. So they are also frontline in helping HOPE to receive information about some plans in the community, in their villages, so that we rescue the girls. They are not sleeping. They are working very hard, and they are supporting this work of fighting against the FGM. Yeah, but now, this time of COVID, it is a challenge. If it will continue, I'm worried very much. If we will not get a support from our police gender desk, not get a support, maybe if they will be stopped not to go in the villages, I don't know what will continue in the villages. If there will be, the court will be closed, this will be a challenge. So I can say we have the increased number of girls due to school closure, difficulty in guaranteeing girls who have been infected in a very crowded condition, big drop in funding due to no tourism, sales, major challenges of getting food from our farm. Plans for alternative rites of passage on hold due to ban on larger meetings. Yeah. As I've already mentioned, I don't know the challenges to come in front of us if the court and the police will continue in this time of COVID-19. Without community outreach, will the FGM resurface? If economic condition deteriorates, will girls be made off? Yeah. Will we be able to feed the girls we are protecting if no and more funding, no support will continue? So those are the challenges which we are facing, and they are soon to come. Thank you everyone for listening, and you're warmly welcome if you have some questions. Yeah, I'm back to you, Janet.
Thank you so much, Rhobi. That was fantastic. So I think we'll go straight on to Michael. And if people have got questions, please do type them into the chat, and we'll come to all of them at the end. Thank you. Michael?
Hi, hello everyone again. This is Michael. I work with an organization called CSEMA, for those who were not here when we were doing the round of introductions. CSEMA is a child rights organization, but we also run the National Child Helpline in collaboration with the government. The Tanzania National Child Helpline uses the number 116, which is a short code number. And you may also want to know that this is a number that has been dedicated for all child helplines in Africa. So basically all child helplines in Africa are supposed to use the short code number 116. And this is something that was agreed by the AU, which will help children, especially children on the move, and children who will find themselves migrating from one place or one country to another due to some emergencies or pandemics like these ones, to call 116 in any country that they'll be, because it's an easy number to remember, and then they can get support, especially talking of mental health and psychosocial support. That is something that is a need right now. So the 116 number is a very important number for Africa and for Tanzania as a whole. So to contribute to what Annemarie and Rhobi have presented, so the child helplines across the globe, especially Tanzania and any other country or in any other country, are part of the national child protection system. So like in Tanzania, the Tanzania National Child Helpline is a core component of the child protection system. And in times like this one, where we are facing a pandemic like this of COVID-19, child helplines and the child helpline in Tanzania is playing a very key and important role in listening to children who are calling concerns, and this helps to calm down children, especially those who are stressed. But also it supports children by referring and linking them to the government referral systems and service providers, who we call frontline child protection service providers. Something else I wanted to mention is that the counselors that are working at the National Child Helpline in Tanzania, most of them have a background in social work. And in 2018-2019, we were glad to partner with UNFPA, and our counselors were trained on specifically responding and addressing cases or calls related to FGM and child marriage. So there was a specific training on this, and this increased the quality of response and the quality of services provided at the child helpline, talking of on-phone counseling and psychosocial support counseling via the phone, especially for girls who have escaped from their homes to go and seek shelter in shelters like the one Rhobi runs in Serengeti and also others in Tarime. But also keeping in touch with them, calling the counselors for support, and also trying to calm them down and also provide all the important information they need to know while they are at the shelters. So with this, we are happy to say that the Child Helpline has been a very important partner to CSOs and NGOs that are working to end FGM in all the regions where FGM is practiced in Tanzania. And we are in sharing some best practices. The calls that we get at our call centers, we usually refer them or link them with service providers down on the ground. And shelters like the one Rhobi's run becomes very helpful, because if we do not have a shelter like the one that she has, and we have a call that came in the middle of the night, and this girl needs support, needs a place to stay. Because something else I want to mention is that apparently, especially in my country, the child protection system goes to sleep when the sun sets. So if you don't have a coordinated and improvised response mechanism like the ones Rhobi and her organization have employed in Serengeti, like having the digital volunteers who go around and also work overnight. Sometimes the government-owned, the government system usually is not very reliable during the deep nights. So when you get a call at night, we can only rely to people like Rhobi and her team to rescue a girl and put her in a safe place, so that we wait in the morning, and now the government protection system now takes up the case. So I wanted to emphasize the importance of that in the child protection systems in our countries. But another thing that I usually want to say is very important for child helplines and the child helpline in Tanzania is, we know in some countries, FGM is a cross-border thing. It crosses borders, especially if one part of a country puts a lot of strict measures to curb FGM. Folks might run or cross the border to go and perform an FGM to a girl. So with efforts that are going on, I know Anna might have spoken about this. We have a cross-border ending FGM declaration that was signed between 4 Eastern African countries: Kenya, Uganda, Somalia, Uganda, Ethiopia, Tanzania, and I think Somalia, if I'm not mistaken. Anna Holmström will correct me. It helped in having interventions that all the countries that signed the declaration have coordinated their efforts and plans in making sure that interventions in ending FGM are in line with the declaration. And child helplines comes in as a very important component of this, because in all these countries, the child helplines and childlines in these countries use the number 116, which is an easy number, again, like I mentioned, for children to remember and also to report cases on. So with this, it brings improvement in trying to reduce and prevent cases of FGM to girls. And more specifically, in a case like this one, where we have lockdowns, where we have restricted movements, parents and caregivers use this opportunity to sneak in the night and go and cut girls. But if the child helpline is there, then it's a good thing. If the communities understand that the child helpline is there, they can call us and we can always respond through the systems, the informal and the formal systems, by rescuing girls, making sure we prevent ongoing cases of FGM. Janet, I know I was given only 5 minutes to give my presentation. I think I've surpassed my time, so please forgive me for that. And
no
thank you very
worries.
much.
Thank you very much. And I will go straight to Anna.
Thanks, everyone. I'll take less time because I've seen that there are people like Tony from Kenya and Halima from Tanzania who are online, and it would be great if more people have chance to contribute. Really, I just wanted to say that I join the rest of the speakers in saying that we are extremely worried that our excellent progress in ending FGM might be jeopardized by COVID-19, though the evidence is limited, but we are worried. Previous to this, Tanzania had made some of the best progress anywhere in terms of decreasing rates of FGM. We've had a 10% decrease since it was criminalized in '98. Though the progress has been uneven, so in regions like where Rhobi is working, Marwa, as well as regions like Manyara, where it's still at 58%, so the progress has been uneven. But still we were alerted by UNFPA 2 years ago that if we do not accelerate our efforts and investments in ending FGM, population growth might actually jeopardize in terms of the numbers of, absolute numbers of girls at risk of FGM. So already we were told that we need to accelerate efforts and improve investments, and then COVID-19 came along. So we can't afford to slow down during this period, and we can't afford to let girls down. So we need to innovate and accelerate. The progress in Tanzania has been in part due to the people who have committed their lives, like Rhobi, into the work of ending FGM, but also there's a very good legal and policy environment in Tanzania. And notably the police, gender and children's desks working very closely with NGOs. We've also made some progress in the health sector. It's now integrated into the GBV management guidelines that all healthcare providers should be able to communicate with, for example, with new mothers who have undergone FGM, so as to prevent them from subjecting their daughters. So the policy and law environment is pretty good. Now what the literature that Annemarie was referring to on domestic violence is telling us is that we need to bolster those services at this current period. And we can't, so rather than slowing down and being careful, we need to invest even more in those. And that will prevent, that will help us to protect women and girls from domestic violence, but also from FGM and child marriage. And what, for example, the Center on Global Development is recommending that we do is not only saying bolstering the services in general, it makes a specific call for expanding shelter and temporary housing for survivors. So we need to be supporting people like Rhobi now more than ever. And then the same literature, as well as the UNICEF literature that Annemarie referred to, says that we should develop more channels for virtual consultations through helplines like Michael's and radio and mobile phones. In Tanzania, we have the National Child Helpline who need more support so that they can make more girls aware of their services. In Tanzania, I saw that somebody on the chat was asking about radios. We have a fantastic network of community radios. They are under a network with the Tanzania Development Information Organization. They have 34 community radios around Tanzania, and they reach 15 million people. And if you look at the demographic and health survey for Tanzania, radios are twice as likely to reach women compared to TV and newspapers. So really, radios are our ally in Tanzania. Finally, in terms of more recommendations coming from the Center for Global Development, specifically to donors, is that we should be increasing currently funding for emergency shelters, and interventions that help referral to those shelters. The second thing is that we need to be supporting more psychosocial support services. And then there's a specific mention that in these times, we should implement and invest in flexible funding mechanisms. So in times of uncertainty and crises, donors and implementers should reflect timely policies and guidelines for grantees and staff which allow flexible funding. This includes provisions for decreased reporting requirements. So we should be helping our partners on the ground, and we should be making it super easy for them to get that support and not burden them with complicated reporting requirements. And I was happy to see my colleague from Felm is online. She's Mia Barrow, and she's excellent at catastrophe funding. We just gave a grant to Tanzania. We're doing a community radio programming on COVID-19. And that was a really nice experience of very light reporting requirements rather than heavy. And I think that should be the sort of support we are giving now. But let me stop there. And just to say thank you for Rhobi and Michael for continuing your efforts. And let's work together to make sure that we don't lose everything that we've gained. Thanks.
Thank you so much, Anna. Okay, so there was been quite a few very interesting questions. Steph, would you like to unmute yourself and ask your question?
Yes, hello. I had two questions. This is Stephanie from GAMS, Belgium. My questions were about the alternative rites of passage that Rhobi mentioned very briefly, and I wanted to know if she could develop on that. And I also had a questions of the opportunities that you see in terms of campaigning against FGM, so that the current situation could become, as Annemarie said, an opportunity for the fight against FGM, instead of only, of course, a big risk. Thank you.
Thank you very much. Rhobi, do you want to say something about the plans that you had for alternative rites of passage in conjunction with FORCO, briefly?
Okay, thank you. Thank you very much for that question. About rite of passage, the plan which we have is conducting community capacity building, targeting different groups in the community, but also doing some ceremonies in order to, in collaboration with those traditional leaders, mothers, parents, in a targeted village, so that they know that there is I can say we call it the FGM ceremonies without cut. So the girls and the parents celebrating together, and that this is showing indicating that the girls have grown up and now moving from one stage to another stage, but without cutting them. So we have those plans to do, and all those, they need interaction with the community. And for now, it is impossible for this time of COVID-19. Yeah.
Thank you. And then would Annemarie or Anna like to say something about repackaging awareness to make COVID into an opportunity rather than a crisis?
Yeah, okay.
Well, what I saw when I was studying the research that was done in different countries in West Africa following the Ebola crisis is that the message that Ebola was spreading through blood transmission was really making the difference. So people started to become really very much afraid to get Ebola, of course, because Ebola was much more deadlier than Corona. So that's why different actors that are important in fighting FGM stood up. So those were religious leaders, but also, for example, the Suwais, but also the government. And they didn't want the virus to spread so quickly. And if I'm translating that to the current corona situation, it could perhaps work. We are all aware, at least in Europe, of the importance of social distancing and the 1.5 meter. If you come in this circle of 1.5 meter, the virus will spread quite easily. So if a cutter, of course, is cutting a girl, she will have she will come close to the girl, and the virus could spread easily. So an opportunity I see here is that we need to make people aware how easy it is to spread the virus, and that might be a reason to stop practicing FGM, as it was a reason to stop practicing FGM during Ebola.
Thank you very much. Rhobi, there's a question. What role do you think religious leaders can play to support you during this time?
Yeah, religious leaders can support in 2 ways. Some of the religious leaders can, during their during the service, church service, they may announce and insist their people about the effects of FGM, and that telling their Christians or their Muslims, their members, about the effects of violence to women, etc., so that every parent should be very serious, taking in a very serious way to protect their daughters and their children, I can say, even the fathers, even allowing the girls maybe to report any cases which it's planned upon them. Like if their parents are planning to cut them, they may report to them. But also, even now, we have some of church leaders who are also reporting to us, telling us what is going on to the community, but also some helping some of the girls to be rescued, whom are forced by their parents to be cut. So even now we are working with these religious leaders through that way. Thank you.
Thank you. Tony, would you like to say anything about the experience of what's happening in Kenya currently?
Well, allow me to say that the Kenyan activists have really taken the opportunity to use vernacular radio stations and also social media in their campaigns. So they are, like the last 2 weeks, we have found so many activists taking part in different radio talk shows across the country, and also in some of the vernacular TV stations. And also I have seen hashtags like end FGM, prevent Corona trending in Kenya. So it means that people are still lobbying and using the available resources and means of communication to sensitize the community. But having said that, I would also like to say that there were some suspected cases in some of the places in Kenya, like in Samburu, where some girls, like around 45 of them, were reported to have been cut. But I saw a report yesterday or today, earlier today, I saw an article that was saying that the anti-FGM board had taken care of that, and the chiefs were going door to door sensitizing the community members on the same, and also trying to find out more about the reported cases. We also had some reported cases in places like West Pokot in Kenya, like 5 of them. That is from the local activists that I know working in those areas. So yes, there are cases that are coming up, but the anti-FGM board is taking care of them, and the activists are also taking care of them. But I won't like to say that we cannot be so sure about the same because of the limited movement of the activists from one place to another to go and find out about what is happening. Also, people have been using the traditional numbers, 116 for the child helpline and also 1195 for the gender recovery center. but you find out some of the activists who went to the radio stations, some of the people who called in were very skeptical about those numbers, like 1195, about the response they get from the government and also the people who man those numbers. So I believe that maybe after this pandemic, we can be able to improve more on the response from those numbers going forward, and the people will have more faith in them, and they will feel secure to call in at any given time and seek for help from those numbers. Thank you.
Thank you very much, Tony. We're almost out of time. I'd like to give the speakers a chance to say one more thing very briefly if they wish.
Thank you everyone for attending this meeting, and thank you Annemarie and Janet and everybody. My addition, I would like to say, you know, even in our police, they have given also some restrictions on how to make the, you know, the rooms where people who are arrested are put in. They are not very big. So like now, they have asked only to try to reduce the arrest. So I can say, like last week, we arrested one family, and also we get even some people from Kenya. Also, they came to the ceremony. Almost like 15 people were arrested. But finally, they were all, maybe most of them were out, only 2 people remained, the father and mother. So my question is, because for now we have the list of the girls who already cut, and we need even the law to take action. But for now they are saying we have to wait, because arresting all these families, it will make our rooms be full. And this is time of COVID-19. I just want to share that challenge. So it limits us how to work. Yeah, thank you.
Thank you, Rhobi. Anyone else? Yeah, Michael.
Yeah, my parting shots will be, right now, the formal sector that we depend on to respond on cases of violence against children, and more specifically FGM and child marriage, is overwhelmed. Talking of the police, talking of the understaffed social welfare workforce in our countries. So most of them have been diverted to go and address COVID-19 specific cases, where most of them will be working in the quarantine centers and so on. So we are facing difficult times, especially now, if we get a case where we need the intervention of a social or welfare officer or a police who has been trained on responding to GBV and violence against children cases. Talking of the police and gender and children desks in our country, Tanzania, we don't get a very good response to them, because most of them will tell you that I cannot help right now because I'm in a quarantine center providing services to the persons who have been found positive on the COVID-19 tests that are being done. So these are very trying times, and we need coordinated efforts, especially now focusing on the informal sector for making sure that and this is a learning, to me is a learning that as we continue to address the COVID-19 pandemic and all the impact it is giving to us, we need to change our programming, so that at least we also need to put a lot of efforts in investing in the informal sectors of child protection, so that when it comes to times like this of a pandemic, where the formal sector is taken away and is overwhelmed with response services, then we have a place where we can cling on. so that the normal response services that you need, the mental health and social support services that ought to be provided by the formal sectors needs to continue. Like now in safe houses, like where Rhobi is, if you don't have people who are providing psychosocial support, counseling, especially the social welfare officers, then it's going to be a very huge problem because of the mental health of the girls, that mental health state of the girls who run away from their homes. So
thank you
thank you very much.
Thank you, Michael. We're almost out of time. Annemarie and Anna, do you want to say a couple of sentences, max, to conclude before people leave?
Yes, I will keep it very short. In the chat box right now, I will put my email address. So I would like to thank you very, very much for attending. Let's keep on sharing knowledge, sharing information. We are at the start of a very hectic time, most probably, that will impact our work tremendously. There's no research yet, but we need to, build up the evidence. So let's continue sharing knowledge. I would love to hear from all of you what your experiences are. I would love to document them as well. So please, let's do this together. And thank you, Janet, again for organizing this call.
No problem. Happy to have another one if people think it's useful. Anna, do you want to say something?
No, really to just ask everyone, because I know that a lot of you are those who are in the front line, as well as people from FAVCO and others who are great supporters of ending FGM, to keep up and make this a priority during COVID-19. And to echo Annemarie's, let's document the cases that we hear verbally and over WhatsApp, and let's keep a record of them so that the knowledge base becomes a reality, because I think we are quite capable of contributing to that collectively. Thanks. And thanks, Janet, for everything that you do too.
No problem. Well, thank you everybody for attending. So I will be sending out the presentations and the recording shortly. So thank you. And please stay safe, everyone.
Bye.
Thank you. Bye, Janet.
Bye. Bye.
Thank you.